Okay, so here's where we left off with the chapter 24 video. So one of the major diseases of the respiratory system caused by a bacteria is called whooping cough or pertussis. The organism's name is Bordetella pertussis. It's a small gram-negative coccobacillus, and encapsulated. The virulent strains are encapsulated. You may have heard the term Bordetella before. It's actually named after the person, but it's also a common disease and vaccine in dogs. It's also known as kennel cough. So the organism that causes kennel cough in dogs and whooping cough in humans, they are very closely related organisms. It is pretty much considered to be a childhood disease. There's three stages. The catarrhal stage resembles a cold. The paroxysmal stage is when there is very, very severe coughing, especially at night. And the coughing is so terrible that it can actually cause ribs to break. And then the convalescent stage is, of course, recovery. You don't hear a whole heck of a lot about it anymore in the United States because of the vaccine. This is, a really important vaccine for young children to get because, while it's not too deadly, it's terrible. I mean, imagine being a little kid, you can't sleep because you're coughing so bad. You're coughing so bad that you can break your ribs. There is starting to become a resurgence of whooping cough in the United States due to the lack of the vaccine being used, part of the anti-vaxxer movement. Antibiotics are not effective at treating the actual patient, but does help in the reduction of transmission. So even though the antibiotics aren't going to really make the person feel better, it does help to reduce the transmission of the disease, and immunity is good after recovery. So usually if a child does get whooping cough, they just get it once and then they're immune to it after that. Tuberculosis, or TB, is a disease we have mentioned before. The bacteria is called Mycobacterium tuberculosis, a highly resistant type of bacteria. It not only, and we're going to see this in a second here, not only is it resistant to phagocytosis, it actually wants the macrophage to grab a hold of it, because that's actually part of its pathogenesis. Is it duplicates and then eventually kills the macrophages. So not only is it resistant to phagocytosis, it actually turns around and kills the macrophage. This is an extremely dangerous disease for people with HIV or AIDS. The treatment is 6 months of intensive antibiotic therapy, usually IV antibiotics, and most of that time the person is in the hospital and they are secluded from anyone else to prevent anyone else from getting the disease because it is highly contagious as well. You've probably heard of the Mantoux or TB skin test. So that's like if you're trying to get a job working with children, working in a nursing home, pretty much anywhere in the medical field. They give you this little injection under the skin, and it's to test to see if you've ever been exposed to the tuberculosis bacterium. Sometimes you will get a positive result, but you don't actually have the disease, or if you ever got the vaccine. The vaccine is not commonly used in the United States because it does cause a false positive on the skin test. So people who've been through the military, people from other countries, people who have been exposed to the bacteria but not actually gotten the disease, they will come up positive on the skin test. So if you are trying to get that job and your skin test comes up positive, you have to go to the doctor, you have to get chest x-rays done, and the doctor has to basically sign off on your chest x-rays saying that you are free of tuberculosis. But by that time, the job may already be filled, so obviously a positive result on the skin test is going to cause some difficulties there with getting a job. The vaccine is not terribly effective, and it can possibly be dangerous for people with AIDS, but it is a vaccine that's used in other parts of the world. So tuberculosis, 100 years ago, 500 years ago, was a major, major killer of humans. It is a disease that a lot of people think is the disease of antiquity, a disease of like the 17 and 1800s. That is not true. We still get about 9 million people a year infected, and 2 million people die from tuberculosis. So yes, it has very much been on the decline, but it's definitely still around. Any major hospital in any city is probably going to have a couple tuberculosis patients. Again, they are sequestered from other people, so the other people don't get it. And then with the HIV epidemic, we saw kind of a little bit of a return of tuberculosis because with a weakened immune system, it's that much more dangerous. So it's very important to realize that tuberculosis is still a disease that's around. It's still a disease that we have to be very careful about. Now, the pathogenesis of tuberculosis is going to be one of your short answer questions. So it's going to be super important that you understand these next couple slides, because again, it is going to be a short answer. This is in your book on page 686. So the first thing that happens is the tuberculosis bacterium reaches the alveoli, and then they will be ingested by an alveolar macrophage. If you remember, I said that the alveolus has a good collection of macrophages to keep infections from occurring. So tuberculosis will actually multiply inside the macrophage, and as the macrophage is essentially being attacked from the inside, it's going to release cytokines, which gets more macrophages to come to the area. The more macrophages that come to the area, the more are going to be infected by the tuberculosis bacteria, so the process just kind of gets worse and worse. So then after a few weeks, you can possibly get symptoms of tuberculosis, but depending on the individual, it may not be as severe. They may think it's just a cold. They may just think that it's, even like allergies, so they may not, fully know. And then what happens is you get this formation of a thing called a tubercle. A tubercle it's almost like a tumor in a way. So what happens is you kind of get this shell of infected macrophages that kind of create this cyst-like or tumor-like structure. And then on the inside is you get kind of like these macrophages that are dying off. So then that process can continue. That can go on for weeks. It can go on for months. And you get this caseous center that forms. So basically you have the bacteria is kind of multiplying and multiplying, and the macrophages are just kind of dying and dying. So then as the caseous center enlarges, we call that liquefaction. If liquefaction continues to the point to where the tubercle ruptures, it essentially, will rupture, and then a whole bunch of bacteria will go throughout the lung. It'll get into the circulatory system, the lymphatic system, and it spreads very, very quickly. This is one of the reasons why back in the day tuberculosis was called consumption, because it will literally consume the patient to where they just crash and die very quickly. So you can have someone who is not so sick, and then all of a sudden they get very, very ill, and they crash and die very quickly. It's a terrible, awful way to die. Very bad infection. And, of course, back in the day, before we had a lot of hospitals and treatments, lots and lots of people died of tuberculosis. Nowadays, we can treat people, we can save people, but again, the elderly, people with HIV or AIDS, very dangerous and very deadly for those groups. So make sure you can summarize these 5 steps. I am definitely not looking for these big long paragraphs, okay? But in your short answer, I will ask you to, essentially describe the 5 steps of the pathogenesis of tuberculosis. So make sure you can summarize these 5 steps you know, each one into like maybe a sentence, something like that. Make sure you have the keywords, you know, what the bacteria does, what happens to the macrophages, turbicle, caseous center, liquefaction, all those important terms. And again, that's in the book on page 686. All right, different types of pneumonia. So the typical most common pneumonia is called pneumococcal pneumonia. It's caused by Streptococcus pneumoniae. Obviously, you can see in the name the word pneumonia is there. Symptoms: high fever, chest pain, difficulty breathing. Penicillin and quinolones are the antibiotics that are usually used for pneumonia. And again, just like tuberculosis, pneumonia, very dangerous for the elderly and people with HIV or AIDS. Haemophilus influenza pneumonia. We've talked about this organism before because it causes a couple other different diseases, but this is the one they thought caused the flu, so they called it influenza. They were wrong because, of course, the flu is a virus, not a bacteria. So this is actually a bacteria that causes a type of pneumonia, tends to affect people more with weakened immune systems, poor nutrition, diabetes, alcoholics, or people with cancer. Mycoplasma pneumonia is known as walking pneumonia. It's called walking pneumonia because it's a much less serious version of pneumonia. So the person's still walking around. They're not in the hospital. They're not debilitated. The problem, of course, is if they're walking around with pneumonia, they can spread it to other people. But it doesn't make you, you know, super sick. You may just, again, think it's a cold, think maybe it's just, you know, mild flu, but it's actually Mycoplasma pneumonia. It was thought to be viral, and then it was discovered that tetracycline, which of course we know tetracycline is one of the most broad spectrum antibiotics, it happened to help it, and then they were able to discover it is a bacteria. Ornithosis, which used to be called psittacosis, this is actually a type of pneumonia spread by birds, or more specifically, bird poop. So bird poop is just, you know, filled with pathogens, dangerous organisms, all kinds of different types of dangerous bacteria feed off of the bird feces. So this particular bacteria is Chlamydophila psittaci, which ornith means bird, and then the psitta, that actually refers to the group of birds that parakeets and parrots are from. But they just call it ornithosis now because it's not just parakeets and parrots, it's also pigeons and chickens and geese and ducks. Any of them can spread this type of pneumonia. So if you have pet birds, or, you know, if you work in a pet store, you know, if you're around parrots and parakeets a lot, and, you know, or if you have chickens and you're around that poop all the time, you really need to be wearing gloves. You should wear a face mask. You should be very, very careful anytime that you're around bird poop because it does have a lot of dangerous pathogens. Other types of bacterial pneumonia, legionellosis, also known as Legionnaire's disease. This is caused by Legionella pneumophila. It was named because of an outbreak that occurred at the American Legion in Philadelphia. It was actually ended up being faulty air conditioning systems or ventilation systems where the air wasn't properly ventilated, so the bacteria was just growing and growing and growing. Again, thought to be viral at first until they discovered the actual gram-negative rod. So that was that one. Chlamydial pneumonia, Chlamydia pneumoniae, very closely related to the cause of ornithosis, but this disease more resembles Mycoplasma pneumonia, so it more resembles walking pneumonia. Common in college students living in dorms because, again, they're in those close quarters, they're sharing bathrooms and all that kind of stuff. And then Q fever was first reported in Australia. The organism is called Coxiella burnetii. It's a parasite of ticks. It's passed along to domesticated animals and then passed to humans. And again, just another type of bacterial pneumonia. They're kind of, you know, as we start from the previous slide and work our way through, they're kind of getting less and less and less common. All right, that's it. So we're going to pick up with viruses next.